am Dr. Courtney Phillips, and I have the pleasure of serving as the Executive Commissioner for the Texas Health and Human Services Agency. Through that, we have over 40,000 individuals that serve as team members that deliver services to more than 7 million Texans each month. So let's take a minute to think about that. 7 million Texans each month we serve. When we talk about 10 years from now, what does that look like? With the estimated numbers serving 35 million entering into Texas. That looks like us serving 9 million individuals on a monthly basis here in Texas. How do we gear up for that? How do we prepare for it? Well, what we've been working on for the past couple of months at HHS is our first annual HHS business plan. And many people ask, why do you need a business plan? You guys have strategic plans, you have mission, vision, why do you need a business plan? Well, our business plan helps us to focus on the areas that we're going to work on over the next year. And so the business plan that we released this year, October, analyzed 10 different initiatives, 12 different initiatives, 72 goals, and 337 deliverables. Again, 12 initiatives, 72 goals, and 337 strategic initiatives that allow us to provide those deliverables. Now, it takes all team members working together to make this happen. But we can't do everything at HHS alone. It takes us strategic partnerships, working with those that we provide services to, those who deliver services, our legislative members, and all stakeholders in the healthcare community, nonprofit, private organizations. We want everyone to come to the table and help us to deliver on these goals. This provides us the opportunity to focus on certain things within the healthcare sphere. And so while we want to prepare for 10 years, we must start today in making those improvements here in Texas. What do those improvements look like? And why are they important to us? There are many things that we know that have been successful in the healthcare field, but there are opportunities that we can improve upon, and it takes HHS leading some of those efforts, partnering with other organizations. Our annual plan that we release is called the Blueprint for a Healthy Texas. And again, we work with stakeholders across the state to gather this information to look at what we're going to focus over on the next year. We talk about our baseline on where we are for each initiative, for each goal. We talk about the strategies that it will take to help us achieve those. And at the end of this fiscal year, we're going to report out of where we stand. And again, we want to be successful in every one of those 72 goals. But if we're not, we want to be able to stand in front of the public and explain why not. What else do we need to do to make our success? What else do we need to do to hit those targets? And I'm going to walk through some of those initiatives and some of those goals in a minute. But it really is important for us to understand why we did this and what's the framework behind it. And so we have numerous areas that we work on in HHS. But again, this is our opportunity to provide focus, some key elements that we're going to work on. It provides focus for our team members, for all stakeholders, for those that we serve, for the legislative members who have invested in us and entrusted us to serve Texans. It provides an opportunity for us to rally around specific initiatives. When we decided to do this plan, we created a framework based on 5 commitments. And our commitments, we really wanted to look at, we're committed to efficiency, effectiveness, and process improvement. So we want an agency that operates very lean, an agency that breaks down the barriers for those who are providing services and those receiving services. We heard from individuals who provide services and receive services that we're not always the easiest to do business with or to navigate the system. And so many of the elements outlined in our business plan starts to break those barriers down. Another commitment is protecting vulnerable Texans. What does it look like for individual who needs behavioral health services, individuals who need developmental disability services, or any disabled services? What does it look like in terms of those individuals navigating services and can't get through? How do we relieve those barriers to make a difference in their lives? Another commitment is to improve the health and well-being of all Texans. What does that look like? What elements work? What elements can we expand upon here in Texas? Another commitment that we have is to make sure we have an agency that's built on integrity, transparency, and accountability. That's part of why we did this plan. We want you to know where we stand today in those 12 initiatives, those 72 goals, and where we want to be at the end of the fiscal year. Where do we want to end up as Texans? Where do we want to be for each one of these elements? And lastly, we want to deliver the best customer service and build dynamic relationships. As I mentioned earlier, we can't do it alone at HHS. It's impossible. We need strategic partners at the table. We need you all. We need those receiving services, those providing services, and all stakeholders who are advocating for Texans. We want you at the table, rolling up your sleeves and helping us to make a difference in the lives of those we serve. So let's talk about a little bit some of the elements that we have in our plan. The 12 initiatives, 72 goals, and 337 strategic deliverables that help us get there. One of those elements is around behavioral health services. We know the community services that we have here in Texas that we provide at HHS. Anyone who has access to those services in the last year, they have had a 99% non-hospitalization rate. So we wanted to capitalize on that success and expand the services that we provide in the community-based setting by serving an additional 8,000 more individuals in a community-based service in terms of mental health services. That's one of our goals that you'll see in the plan today. Another goal is increasing the number of individuals that are waiting for behavioral health state hospital services by serving an additional 300 individuals in that setting. We want to make a difference and improve the entire continuum of behavioral health services. Another area that we're working on is disability services. One of the things that I came on when I came on last year in October is it was really tough to navigate the system. Internally, we have individuals that navigate our system both in the Medicaid realm, aging and eligibility services, the HDIS division, the IDD behavioral health division. And so for us internally, if it's tough to navigate that system, imagine a family member or individual who's trying to access services, what the barriers are that they are experiencing. So how do we take a step back, hear from them, and build a plan to reduce some of those barriers as well? And so over the last couple of months, we've been doing town halls across the state, hearing from individuals that are expressing their concern and want to help us build a plan going forward to make those improvements. Another area that we outlined in the plan is around women's and mothers and children. That's an area of opportunity that we have in our state. We want to look at LARCs, long-acting reversible contraceptives. How do we increase that rate? We know that unintended pregnancies can lead to poverty, situational and generational poverty. So how do we do a better job increasing access? We know that there's barriers around it. One of the things that we want to do is we want to work with the Texas Department of Criminal Justice System. We want to work with the university health systems. We also want to create some mobile units where we know we have access issues in certain areas of our state. So we're currently analyzing our data, looking at where can we make a targeted effort and make a difference. Another area that we're working towards is increasing the number of pregnancy medical home sites. We had one pilot site over the last year that had very successful results. And so we want to increase the number of sites to 5 this year. And so again, we're analyzing that data across our state to see where are the best places for those particular sites. The particular data that we looked at is that the decrease in NICU rates, the NICU rate stays, increase in breastfeeding results for those mothers who actually presented at the medical homes. Also looking at in terms of the increase of LARC usage at those pregnancy medical homes. So understanding where we've had success in certain areas and how do we capitalize and increase that success. Another area that we're looking at is making sure breastfeeding. We all know the results. We've seen the scientific studies and we know what the data says, but yet we still have the opportunity to improve here in our state. So how do we learn from those successful areas, take those evidence-based intervention and practices, and roll into some of the other areas that we have not had the success? Another area that we're looking at is creating some mobile mammography units. We know in the I-35 corridor between Temple and San Marcos, we lack of a BCCS provider. We have opportunities and work to do in some of these areas, and we want our partners at the table to make that happen. Another area that we're working on is our well child visits and working with our managed care entities to make sure we increase the number of individuals under 15 months getting the recommended well child visits. This is a prevention mechanism so we can have early intervention, early screening, and detection. Some other areas that you'll see in the plan is related to our managed care organizations. How do we work with them to provide better services? And how do we work internally to increase our oversight to make sure we're getting the services, the quality services that we are paying for? And so we're looking at our prior authorization reviews. We're implementing a medical review organization, an external entity to do some of those independent reviews, shoring up our fair review hearings process by adding medical expertise, and just doing our overarching oversight improvement. Another area that you'll see in our business plan that's probably one of the most forward-looking is our Texas Works Path to Success. This is where we're going to be working in the Harris County area, working with the USDA and the Goodwill Industries in Houston to look at working with 100 high school seniors and able-bodied adults, working with them to prevent situational and generational poverty. How do we engage them in employment and educational training opportunities? How do we help them to provide stable housing opportunities? How How do we reduce food insecurities? And so this is a complete wraparound case management entity approach that we're going to be taking with 100 individuals and measuring that success at the end of the fiscal year. Again, the plan is 12 initiatives, 72 goals, and 337 strategic deliverables to deliver upon. That's a heavy lift in 1 year, and we plan to do it again next year. But that can't be done without partners as well as internal team members. So one of the other initiatives that you'll see in our plan is taking care of our team. How do we build the current team up, and how do we recruit the best and the brightest to come to our organization? Making sure that we have a positive culture at HHS and that we can compete and retain team members that are committed to serving is critical for our success. And so I always do a shout out and a recruitment effort at any event that I'm in. So if you are looking to join a wonderful team, please consider Team HHS, because we are gearing up for today and the future of making sure we are able to serve those we have been entrusted to serve. So when we talk about the future of the healthcare of Texas, we know that Texas is the second most ethnically and racially diverse state. So how do we gear up for that? We at HHS, you'll see in our business plan, it's not outlined as an initiative, but it is a spotlight that we are working towards in terms of health equity and disparities. We want to make sure that not just on the back end that we're putting in implementation and programs to solve the gap, but we want to look at the front end. How do we close the bleed on the front end in terms of health disparities? How do we make sure that the policies and programs that we're putting in place don't increase the current gap? We want to make sure that we're questioning any rules that we put out from providers and practitioners' perspectives. Are we unintentionally creating a health equity gap? And so those are some of the things that we want to partner with other entities in terms of how do we stop that bleed on the front end, and then they're able to focus on the back end what currently exists. So when we talk about the future of healthcare, we want to be at the table. Texas Health and Human Services Agency wants to be at the table. We look forward to partnering with all entities who are interested in driving forward and helping us to drive the change and make those necessary improvements. Again, HHS is committed to serving. We have 40,000 team members who want to make a positive difference in the lives of the individuals we serve. We are ready to roll up our sleeves and partner and make a difference.